Now we are going to have the discussion, a Q&A, also about the posters that these 4 posters that you can see. There was still, by the way, a question to Khaled Esseddin. Are you still with us, Professor Esseddin? I don't think he's... okay. Any other questions about the posters or about the talks we just had? Well, I do have a question to Shivangi Rana about the metabolic syndrome in childhood vitiligo. And we just also heard a presentation from Caroline Lepoul, where she found that a significant number of the vitiligo patients had hypercholesterolemia. And now you also show some similar results, but also with a higher body mass index. I wonder whether this is a true kind of relation that would hold in different countries and different cultures. I often have the impression that my vitiligo patients are not really have a high body mass index. So maybe there's also a lot of cultural kind of influence on patients and the feeding pattern of patients. So I'm not sure whether the relation is really a causal relationship between vitiligo and the body mass index and hypercholesterolemia. Do you know from other studies in other countries or other cultures?
Thank you, sir, for the question. Am I audible?
Yes, we can hear you.
First of all, I'm very sorry because I'm traveling, so you might hear some background noise. I'm very sorry for that. So I'll take the question. First of all, sir, this is a pilot study, and this kind of study has not been done in a pediatric population before. So what I have taken is basically there's a study in which in India, they have done a study in which they have done a simple anthropometric assessment, like the body mass index of the patient, of the children, and they have assessed whether the waist circumference and the BMI can be taken into account to assess the risk of metabolic syndrome in pediatric population. So in that study, they have found that with the anthropometric methods or with the simple measuring the BMI and the waist circumference, we can collect those high risk population where they can have a risk of metabolic syndrome. They are not having a metabolic syndrome as of now, but they can have a high risk of metabolic syndrome as compared to the control, because that was also a case control study. So considering that, I also collected the same data, the same by anthropometrical the parameters, and I have used a WHO, the WHO cutoff, which is used for BMI and for the waist circumference, and also for the cholesterol level, HDL level, I have also used the same WHO criteria. So in that, I have found the waist circumference was not significantly different in the cases and control. However, there was a significant difference in body mass index between the cases and control. Considering that this difference was very significant, I have collected the biochemical parameters also, in which I have done the cholesterol level, HDL, triglyceride level, and low density lipoprotein level. Although the cholesterol levels are different, but I cannot say whether there is any significance of that in the study, because although the difference was there between the cases and the control, but the levels were not above the third percentile, which is defined by WHO. Sorry, the 95th percentile, which is defined by WHO. So they were not the abnormal levels, but definitely there was some difference.
Yeah.
So
well,
for the
anyway,
cholesterol level, yes, sir.
Yeah, I think it's certainly interesting to hear that, and something to study also in other populations and other cultures, if this is a true relation between vitiligo and, well, a kind of metabolic syndrome that we know very well from psoriasis. So certainly to be continued. I personally, I have another question to Ju Hee Han from the Catholic University of Korea. And she presented a poster of a huge study showing an increased risk of vitiligo after transplantation, and not each type of transplantation, but specifically transplantation of hematopoietic cells, and especially when there was a graft versus host reaction afterwards. Could you please tell us whether the risk was increased even when the donor had vitiligo in the medical history? I don't know if Dr. Yu Hee Han from Seoul is with us and online.
Oh, yeah. Yeah, I'm here. Thank you for your comments. And actually, in our study, there's a limitation that we use the data of NHIS, but they were lacked information on donor and recipients and disease activity and severity, history of previous treatment, including immunosuppressants, and also detailed information on GVHD. So actually, we didn't have any information on the donor's vitiligo. So for this issue, further studies might be needed to clarify.
But still, I think your data very convincing, very robust data that show that there is a true relation between the transplantation. And then it's still not very clear whether this is the preparation of the transplantation, the drugs, or the cells that you transplant. So very interesting to follow up as well. Let me see, other questions. Well, there was a question for Khaled Esseddin about whether there would be an increased risk with JAK inhibitors when they would be combined with narrowband UVB, especially regarding skin cancer risk. Something that we know, for example, from cyclosporin and especially PUFA, but also less maybe UVB. So would there be an increased risk of the JAK inhibitors when combining them with narrowband UVB? Okay, I think he cannot make it to answer this question. Any other questions about the posters or the presentations? Because otherwise we are
Yes, please. I have just a question.
Oh, sorry.
It's a comment.
Please.
Yeah. All right. It's a comment about the metabolic syndrome. The same way you thought, Albert, I thought when we had a study at our department, and at the beginning I thought that there won't be a relation, but no, they had a lot of findings, and they found that there is a relation between the metabolic syndrome and hypercholesteremia and these aspects, but I don't know the details of the result, and I think it is published. The study is published.
Yeah, very interesting.
We too.
Thank you.
I'm Mauro.
Professor Picardo, please.
We too have done similar studies in about 800, 900 patients that we've seen in the last couple of years, adult patients. We observed that this metabolic syndrome, not necessarily an increase of the body mass index, but hypercholesterolemia, a moderate hyperglycemia, a sort of peripheral resistance to insulin in our patients. So we will perform in all of our patients the glycemia, the insulinemia, and the modification following the sugar intake, just to evaluate the possible peripheral resistance to insulin. We believe that is probably something related to vitiligo, or in any case is relevant to treat these metabolic abnormalities just to help the possibility to have a regeneration of the appearance of the pigmentation.
Okay, thank you.